Now we will discuss about catecholaminergic polymorphic ventricular tachycardia. In this, the tachycardia is present, means there is fast heartbeat and ventricles are affected by this fast heartbeat as a result of the catecholamines, which can be epinephrine, norepinephrine, dopamine, and they are the hormones mainly responsible for fight or flight response. So tachycardia is very common. We can even feel that palpitation or awareness of the heartbeat, and fast heartbeat is there. So if you see the normal heart rhythm, that's the normal cardiac cycle, PQRS complex, and the T wave, PQRS T wave. So this is the normal cardiac cycle on the EKG strip. But this is the tachycardia here, ventricular tachycardia, and you can see these are all the QRS complexes as a result of the fast beating of the ventricles. So this is ventricular tachycardia. If we talk about the different channels associated with this catecholaminergic ventricular tachycardia, usually we have the calcium channels affected, and then these calcium channels in the cell membrane, and then we have the sodium channels. So both these channels are affected, and this affect the contraction of the myocardium, and then the impulse generation or electrical activity generation is affected. So catecholamines affects the calcium channel and the sodium channel in the cell membrane and also sarcoplasmic reticulum, and it affects the contraction of the myocardium and then the impulse generation that causes the ventricles to keep contracting and cause ventricular tachycardia.